everyone, I am Dr. Issa, your OBGYN on call. For our third episode, we will discuss safe sex tips to help you maintain a healthy and enjoyable sex life. Throughout this video, we will explore the different contraceptive methods, the significance of STI screening, and fostering effective communication with your partner. Number 1 is to get protected. Use contraceptives. Contraceptives are methods or devices used to prevent pregnancy and minimize the risk of sexually transmitted infections. They are divided into 4 categories. First are the barrier methods. They block the sperm from entering the uterine cavity. These include diaphragms, male and female condoms, and cervical caps. Second are the hormonal methods. They inhibit ovulation by altering FSH and LH. They thicken the cervical mucus and thin the endometrial lining. Under this category are oral contraceptive pills, injectables, implants, vaginal rings, and hormonal patches. The third are intrauterine devices. The IUD is a small T-shaped device that is inserted inside the uterus. There are 2 types of IUDs. The first is a hormonal IUD that releases progestin to inhibit ovulation, and the second is a copper IUD, which acts locally to induce inflammation in the uterus so that the sperm will not reach the egg. The last type is emergency contraception. It safely prevents unintended pregnancies by inhibiting ovulation 72 hours after unprotected sex. However, in the Philippines, the morning after pill or the Plan B contraceptive is currently not available. However, we OBGYNs can prescribe you with an alternative method, which is called the use-by method. This involves taking a specific combination of oral contraceptive pills that is usually a higher dose compared to your regular daily use. You can check out the description box for more information about this. I also discussed the different contraceptive methods in our previous episode, which is also in the description box below. Number 2, always get tested for sexually transmitted infections. Taking regular STI screenings helps you to know your status and helps you become more proactive with your sexual health. An STI screening determines if you are positive for the different sexually transmitted infections like HIV or AIDS, hepatitis B, syphilis, chlamydia, gonorrhea, and others. It is usually done with a series of procedures such as getting your medical history, doing a physical examination, then proceeding with the laboratory tests. Depending on the screening package that you avail of, you may be tested for the following: HIV testing, which tests for the human immunodeficiency virus, HBsAg testing, which tests for hepatitis B, VDRL or RPR, which are non-treponemal tests which screen for syphilis. A CBC or a complete blood count and urinalysis may also be included in these packages. I recommend consulting with your healthcare provider so that you will know when to get tested for these infections. There may be some infections where there is a lag between the initial exposure to a positive test, so your healthcare provider can definitely help you with this. As for frequency of tests, it depends on the number of sexual partners, the type of sexual activity, and personal risk factors. If you are tight on budget, there are organizations that offer free STI testing like Love Yourself Philippines. You can check out their website in the description box below to see how you can avail of their packages for discreet HIV testing. Number 3, get vaccinated. Protect yourself by taking the human papillomavirus vaccine and the hepatitis B vaccine. As of today, those are the only vaccines in the world that can protect you from STIs and the cancers associated with it. The HPV vaccine protects you from the most common strains of the human papillomavirus, which often leads to cervical cancer, anal cancer, and genital warts. Meanwhile, the hepatitis B vaccine provides protection from the hepatitis B virus, which often leads to liver cancer and chronic liver disease. Because of the high rates of hepatitis B infection in the Philippines, universal vaccination is mandated, so you probably had this vaccine as an infant. Number 4, get connected and communicate. This means talking to your partner about their sexual preferences, expectations, and boundaries. Discussing sexual preferences, boundaries, and histories are essential in creating a safe and respectful sexual environment. This helps ensure both partners are comfortable and have their boundaries upheld. You don't have to discuss in detail what you have done in the past. you only need to discuss crucial information such as STI experiences and potential risks. Sharing this information promotes trust and responsibility, helping both parties involved to make more informed decisions about their sexual health. Aside from those 4 main tips that I've mentioned, here are additional tips to help you maintain a safe and fulfilling sex life. First, use a lubricant during sex, especially when using a condom. It enhances comfort and reduces the risk of condom breakage. I recommend using Lovette unflavored lube with a gel-like consistency and water-based formula. Second is to avoid sharing sex toys. If you have to, please clean it first and wrap it with a condom. There are available sex toy cleaners in the market for quick cleanup, such as the Spray and Play toy cleaner. Third, educate yourself with STIs and sexual health topics. Being well-informed empowers you to make more informed choices. You can check out my TikTok at obgynoncall.ph or the Love blog for more educational guides. Lastly, consent is essential in all sexual encounters. Always seek consent from your partner, and your partner must always seek consent from you as well. Always be mindful of each other's boundaries and comfort levels. And that ends our video for today. Remember that these tips are meant to guide you to have a safe and fulfilling sexual experience. If you have any specific concerns or questions, don't hesitate to consult with a healthcare professional who can provide you with a personalized advice and support. Once again, I am Dr. Issa, your OBGYN on call. Remember to like and subscribe, and don't forget to check out my TikTok at obgynoncall.ph for more related topics. Stay curious, stay informed, and remember that your sexual health matters. See you in the next episode!